I think it's really interesting that having access to unlimited information has actually made us distrust each other more. That patients, in a wanting to feel more empowered and wanting to feel like they have more control over their health and over their lives, have turned to the internet, have turned to AI language models, have turned to Reddit and really said, hey, I think I have to figure this out on my own because I don't think that my physician or my medical provider is actually on my side. I don't think that they're there for me. And that's really hard for us as medical providers to handle because we feel like we're trying as hard as we possibly can to be there for people. I feel like I'm practically killing myself trying to be everything that my patients need and answer all their questions and provide them with empathy and support. But we know that the internet has created a lot of social isolation. And so, what we used to find before in community, whenever we would spend time with our family and extended family and friends and relatives and neighbors, we now are looking for on the internet. We're now looking for that kind of reassurance from our medical providers, from our therapists. We now actually are providing a lot more emotional support from patients than we used to provide. And it's hard for us to do. I love doing it. I'm not complaining about it, but I think that we have to acknowledge that after the internet was invented, everything about our lives has changed. Hi guys, I'm Dr. Goodwin, and in today's video, we're talking about broken trust in between medical providers and patients, and it's on both sides. The patients no longer trust their medical providers, but because of all the confrontation and the fights that we've been having in the exam room, medical providers are really also struggling to trust patients, and I want to talk about that a little bit more today. I think having access to unlimited information online has changed the patient and provider relationship both for better and for worse, because I think that patients now kind of decide what they think is going on before they come to see us, and then they come in ready to argue, ready to tell us that we're wrong, wanting to teach us that we don't know what we're talking about. And that's definitely made it worse. We have definitely come to a place where providers feel that distrust. We feel the anger, we feel the distrust, we feel like patients are extremely unhappy and unsatisfied with our life's work. And that can be incredibly demoralizing. It can be incredibly discouraging. And I know for myself personally, it's really made me want to shut down. It's made me less empathetic when I walk into an exam room to talk to a patient. Oftentimes I'm already braced for conflict. I'm already braced for confrontation. And because of that, I'm not bringing my best self into the exam room. I'm not able to be there for them in the way that I feel like I should be. But I do think that the internet has also changed our communication for the better. And I know that at the very least amongst providers, our communication and coordinating patient care is far better than it was before the internet existed. I think that our ability to transmit new information and the results of medical studies is much, much faster than it used to be. And I think that the way that we communicate with patients using online portals and text messaging is also much better because we can actually give real-time support and real-time answers. I love telehealth because I can call patients on the phone and talk to them and hear what's going on in their lives. And I can actually chart that in real time on the computer, on the internet. Like that's made huge advancements in medicine so that I'm taking better care of people. And I think that helps our patient care. And I know for myself, I definitely practice with 3 or 4 tabs open on my computer. I will have up to date. I will have, Doximity AI or something else. And I love Epocrates for my drugs where I'm looking like maybe AFP, where I'm saying, hey, I'm going to double check or triple check when I don't 100% know the answer because I want to make sure that I'm providing the absolute best care. And now that care has become so nuanced, now that it's become so complex, I think most of us medical providers are practicing with double checking the answers, double checking to make sure we're asking all the right questions, double checking our differential to make sure that we didn't miss anything, double checking, is there some other reason why this lab could be abnormal? And that helps us a lot. We've made huge advancements in safety and patient care because we're able to just look something up. And that's amazing. So the real question is, why aren't we just making these resources available to patients? I think the reason why we're still struggling getting AI models out or getting patients access to provider information is because it does actually take 10 years to learn all of the science, all of the biology, all of the biochemistry, how to read medical studies, all of the biostatistics to say, I can look at the information and see what applies to the specific individual situation, because no patient is ever textbook, anything like the textbook. And every single patient I've ever seen has multiple things going on at the same time. We have to provide really individualized care. And I know that we do. We really care about providing as individualized care as we possibly can and making it very specific to the patient's life and history and situation and symptoms. And so I think that that's one of the biggest issues that we're facing as we move forward. I know that I have looked at jobs where they're asking medical providers to help train the AI, and they gave me a test case of a patient with diabetes who had a decrease in renal function. They were asking, is this AI output good? And the AI basically said, stop this medicine, change this medicine, decrease, the metformin, switch them to glipizide. So it gave a very stark answer. And I didn't know what to do, honestly, because they didn't give you the patient's blood pressure. They didn't give you the patient's hemoglobin A1C. They didn't give you the patient's goals or the patient's weight. I don't know if they're trying to lose weight. They didn't tell you if they had a history of heart attack or stroke or AFib or congestive heart failure, which would absolutely change the medicines that we would give. They didn't give me the patient's insurance, which would also drastically change what kind of medication options the patient have, or where the patient lives and what kind of work do they do. All of that is going to change my medication recommendations. And so they said, evaluate the AI output and tell me what you would say instead. And I fought with this AI because they couldn't give me any more information. Of course not. The AI doesn't have more information in the case. And every clinician needs more information than, 55-year-old male with type 2 diabetes and a decrease in renal function. Like, we need more than that. We need a lot more information than that. Looking at that case really made me realize that the AI needs a lot of work. Like, can it tell you, yes, these are the guidelines? Yes. Because what it said wasn't necessarily a bad choice. It wasn't incorrect, but it was not the individualized kind of empathetic medicine you're going to get from a human medical provider. And I think that patients don't know that. They don't understand how much data we take into account when we're making medical decisions, how individualized our care really is. I've had a lot of patients complain to me that doctors just shove everybody into an algorithm and they just kind of push them onto a pathway and everyone gets the same kind of medicine. And that could not be further from the truth. Every single time I start a medication or change a medication, I'm considering at least 50 different factors. And a patient who's just going to the internet to try to make these decisions for themselves has no context for how much information they really need to have in order to have a really good outcome. Because not only do I care about what else is going on in their life and what other symptoms they have and what their past medical history is or their allergies, I also care very much about the things that they're concerned about. Maybe they're really terrified of dizziness and I want to make sure to pick a medicine so that doesn't have dizziness as a side effect. Or maybe, they had a family member end up in the hospital for hypoglycemia. I'm going to make sure to pick a medicine that doesn't have that as a side effect so that they don't have to worry about it. And that's the kind of thing that AI isn't necessarily going to pick up. So patients have a huge access to information now, and clinicians have access to the same information, but we have a much deeper knowledge and understanding of what's relevant, what isn't, what matters in this particular case, and what doesn't. And how are we going to help doctors and patients communicate with each other when most of the time patients don't know what it is that they're missing? It is so hard for us. We never know what it is that we don't know. That's what a blind spot is. And modern science, not just modern medicine, but the scientific method itself, where we propose a hypothesis and test it and then refine it, is in order to uncover blind spots. Like, that's part of what we do. It's part of who we are as medical providers, is to say, I'm constantly looking for my blind spots. What is it that I'm missing that I don't know? There's an old quote that goes, don't know that gets you. It's what you think you know that's wrong that will get you. And that's the kind of thing that we are constantly thinking about every day. And that's what really sets us apart from wellness influencers, is wellness influencers are very confidently like, this one thing is what you need to do to solve your problem. Whereas us medical providers are always saying, well, it's probably this, but it could be this or this or this. And statistically, the most common thing is this. And the best thing for that is to try this. But if that doesn't work, then try this and this and this. And so it's just a completely different way of approaching how you think about life. And the problem is that adding in doubt doesn't market well, even though you need to in order to be a good medical provider, in order to take good care of people. We add doubt into our language, and our patients, who are hearing on the internet almost entirely marketing language these days, absolutely everything is calculated to keep someone's attention. Having language that introduces doubt, like I think it's this, but it could be this, is so foreign to them. Patients just don't understand it anymore because it's so scary. Like, we want our doctor to say that they know exactly what's going on. We want a firm, concrete answer, because it is absolutely terrifying when there's something wrong with you medically. Even when you are a medical provider, like even when I got diagnosed with my autoimmune disease, I was absolutely terrified when I didn't know what was going on and I couldn't figure it out myself. And I'm running through a differential in my head and I don't know. And I'm calling my friends and reaching out for help, trying to figure it out. Like, you want someone to say confidently, this is what's going on. This is how we're going to fix it. This is exactly what you need to do. And I think we all get really tempted to do that, which is great as long as it works, until it doesn't. And then you've really broken trust with the patient. And so it's very important for us to remember that we do need to be calm. We do need to be confident. And we also need to very openly say, medicine is not as simple as other parts of the world. We can't just say 100%, this is what it is and this is what we need to do. This is what we think it is, and this is what we're going to try. And then if that doesn't work, this is what we're going to try next. My patients have historically responded really well to me saying that, because they understand that even if that isn't what it turns out to be, I do have a plan. Like, I'm thinking it through, I'm looking things up, I'm double checking their chart after they leave the office. And I'm always going to have a plan in place for what it is that we can do next. And when I've approached decision making more collaboratively with my patients, where I'm more open with them and say, hey, this case is a bit more complicated. When you have a patient, let's say, with gut symptoms, and you don't know if it's an IBS or if they have an irritable bowel disease, and you're going to say, hey, we're going to look for these things, and I list them out for the patient, and I will tell them, this is why I think it might be this, and this is why I think it's probably not this. That helps them a lot when they are Googling things at 2:00 in the morning to say, my doctor's already thought about this. And I definitely had patients come in to see me where they ask, like, I think it's probably this. And sometimes I leave a hesitancy. Like, I will actually leave a silent space when I'm looking something up. So my patient will give me all their symptoms, and I will say, okay, really quickly, I have a differential in my head of what I think this could be, but I'm going to look it up really quickly to make sure that I'm not missing anything. And then I will intentionally stop talking for about 10 to 15 seconds. A lot of times my patient will say, well, I was looking online and what do you think of this? Like, they will add something in then, because I've left the space open and I've kind of left it open. It makes me feel like I sound like I don't know what I'm talking about, but I think that's just imposter syndrome. And so then I can confidently tell the patient, like, that's a great idea. Here's why I don't think it's that, and actually list my reasons that make sense to them. Here's why I think it's either this or this or this. And here are the tests we're going to do to figure out which one of these things it is. And so I think my patients have been really happy with my care, because I consistently explain myself as clearly as I possibly can. And I always have a plan for what we're going to try next if what we're currently doing doesn't work. Building trust with patients has gotten a lot harder. Oftentimes, I think it's important to start with really small wins. Like, if I have a patient come in to see me and they don't trust anything that I have to say, I'm going to pick something really small that I know I can fix, like your runny nose or their asthma or something like that. Maybe it's the swelling in their legs. And I'm going to say, okay, here's one concrete thing that we're going to do that's going to make this symptom better. And then when they come back in, 2 weeks or a month and that is better, you've built some trust. You've actually given them something concrete that actually helps them. So I've had to start with small, actionable wins. That's why I was talking about how incredibly important it is to recognize that we have to get our own ego and our own need to be people pleasing out of the way, and recognize that we need to be the adult in this situation. We have all the authority and we have all the responsibility, even though usually we don't have all the power, which is an incredibly frustrating place for us to be as medical providers. And I think that's why a lot of people are considering leaving medicine or are not going into the medical field, because we are stuck between the large government organizations and the insurance companies and patient population that's really unhappy with the care that we have been forced to provide in very specific ways. And I think that's why we're seeing a lot of people move towards towards like direct primary care clinics or private practices that are providing care in very different ways, because we can see that it's not working and we can see that patients aren't trusting us. Two really big things. One of them is I think we need to get our ego out of the way and really recognize that we have a responsibility to do the best we can for patients no matter how upset they are. Like, we can't just shut down and get offended and provide substandard care. But I think the second thing I wanted to say was that it's really important to remember that our patients are angry because they are scared, and they're angry because they're grieving, and that they're sad, and that anger is one of the 5 stages of grief. And so for me, it's so helpful to remember that if patients are feeling angry and they're feeling betrayed and they're feeling sad and they're grieving something, that I need to get to the root of what that is. And I need to help them process that and move through it, sometimes even before we can begin to provide medical care. And that has helped me a lot when dealing with really argumentative patients. Back to authority, medical providers still do have all of the authority when it comes to providing medical care. The government is taking it away a little bit, but at the end of the day, we are still the only people who are prescribing medications, who are doing surgeries, who are saving people's lives in the emergency room. Like, we have the authority to go in and say, hey, this is what you need, and this is what I'm going to do. This is what I believe is going to help your health the most and save your life. And I think that we have the responsibility to do that. I think we as medical providers, when we go to medical school, have agreed when we took the Hippocratic Oath that that was what we were going to do to the best of our ability. That's what it means to say, I will do no harm, is to say, no matter what the situation is, no matter what's going on with the patient, I am going to do the best that I can to provide the best medical care and to try to get my own emotions out of the way. And on a lot of times that does mean that I need to take more time to myself to provide self-care afterwards outside of the clinic, because I get overwhelmed by the patients and how argumentative and upset and confrontational they can be, but that's an important part of providing excellent medical care. And when I say I don't necessarily feel like we have the power, what I mean by that is that a lot of times we can't affect policy. So I'm not writing government laws. I'm not saying what insurance covers. I have no power over how long my appointment times are, or what kind of medications I can get covered, or how expensive those medicines are going to be, or, which hospital is going to provide the surgery at what cost. Like, there's a lot of things that break patient trust that can provide substandard care that I don't have any control over. And we actually talk a lot about that. I talk a lot about that. And that is that being forced to provide substandard care, that my being forced to provide care that I know isn't the best, is actually a moral injury, that I am getting injured morally because I am trying to provide compassionate, empathetic care, and there are organizations that are blocking it. Patients have the power to agree or disagree with my recommendations. They have the power to say yes or no, I'm going to do this, or no, I'm not. That has gotten a lot more obvious since patients have access to all information online. But I think that's always been the case. Like, there have always been patients who would listen to the doctor's recommendations, and there have always been patients who didn't. We have always had patients get diabetes, even long before we knew what diabetes was, because we would say you need to eat less sugar and you need to exercise. And some people do and some people don't. And that's, in my mind, that's a different conversation, because that's getting into how do you actually motivate people to change, which is like a part of the healthcare field. Like, it's an entire subsection of the healthcare field on its own. So yes, patients have power, but it's important to remember that patients still have less power than we do. Even with access to the internet, even with access to AI, they are desperately trying to feel like they have some kind of power and control over their own lives and their own health. And I completely understand that. But it's still a lot less power than we have. As I'm thinking through and talking about all of the different challenges that have come up with patient communication in the last 5 to 10 years, I think it's important to remember that change is possible, that we can change the way that we think, we can change the way that we communicate with patients, and that we can rebuild trust with patients. It's going to take time. It's going to take hard work. It's an incredibly difficult job that we do. We're already playing life on hard mode on a video game. When you go into medicine, life is already harder than your average person's life. And then you add in everything that's been happening. You're putting your video game mode on extreme. And it's important to remember that what you're doing is incredible, that we're already doing extremely hard work, and that we're already working at a deficit that we shouldn't have to work with. And that it's so incredibly important for us to speak up and to make changes in our lives that are going to make it possible for us to provide better patient care and to really advocate for medicine with the government, with insurance companies to say, hey, the way that we're providing care overall clearly isn't working. How can we change it to do a better job and to actually take care of medical providers and patients to the best of our ability? And I think that's really where the conversation needs to go moving forward. And I think it's really important for patients to know that we see the problems. Like, there isn't a doctor who's sitting around practicing medicine right now going, oh, everything's perfect. Not happening. Like, we know that there's a big problem. We know that there's a big break in trust. We know that we need to make a change to the system. And I want patients to recognize that you do have a lot of power. At the end of the day, you are the only one who can actually make changes that are going to affect your health. You're the one who's going to go home and eat the healthier food. You're the one who's going to go home and exercise. You're the one who's going to go home and pick up the medicine from the pharmacy and actually take it. The power over your health at the end of the day belongs entirely to you. And I think it's really important to thank you for the compassion that you've had for your medical providers and the medical system as we struggle through this incredibly difficult transition and the changes that we need to make to American healthcare. And I hope that you find doctors who are looking to change. I hope that you find doctors who are more collaborative. I hope that you find a medical provider that listens to you, that makes you feel heard and understood. And I hope that when you find those medical providers, you keep them and you stick with them through everything, because we're all really discouraged right now. And a lot of medical providers are leaving medicine. And if you find somebody that's actually doing a great job, please tell them, because they need the encouragement right now. Medicine is hard, and I've experienced those difficulties firsthand over many years. And part of what I want to do now is really help medical providers in changing the way that we think about ourselves, changing the way that we think about our identity, and changing the way that we communicate with patients, changing the way that we approach our clinic days and our efficiency. And that's something that I'm really excited to get into, is coaching physicians in every aspect of their lives and just say, hey, right now you're exhausted, you're overwhelmed, you're feeling shut down, you're feeling burnt out. There are some very small but meaningful changes that we can make that will completely turn your life and your clinical practice around, that you don't necessarily have to leave medicine. But there are things that we can do that's going to make your day and your life so much better. There are ways that we can practice communicating with patients that's going to rebuild trust, that's going to help you get across to the message that you're trying to communicate. And at the end of the day, you can actually be the medical provider that you dreamed of being when you were a child. Thank you very much for watching this video. If you liked it, hit subscribe. I'm going to be doing a lot more videos like this. And if you want to follow along, let me know in the comments what you think, what is affecting your practice right now, or what is it that you wish your doctor knew or did differently. And if you're at all interested, you can watch my last video on the medical case that still haunts me, where I talk about a case where I made a mistake. All right, take care of yourself today. Remember that no one cares about your health as much as you do.